All right. Well, I think just judging that we have a pretty packed agenda today, I do want to get started to make sure that we end on time. I'm Jennifer Alexander, and I'll be starting us off today. The lovely Michelle Henne is on vacation, and I'm sure she's having a beautiful, wonderful time, and she'll be back next week, I believe. And to help out today as my co-host, I have Sue Peters, who will be leading components of the session today.
I have big shoes to fill.
Yes.
With Michelle, so bear with me, everyone.
Yes, big shoes for sure. And we also have Lisa providing some technical support. And we've asked one of our team members, Cindy Graham, to also help out with monitoring the WebEx chat box just throughout the session to help us out with that. So if you want to move on to the next slide, I'll just cover again, this is a refresher for many, but some might have missed the last session and need this refresher. For WebEx, to mute or unmute, you press *6 on your phone. If you want to use the chat box on the right-hand side, the WebEx chat box, please mark send to all participants if you're responding to discussion and questions so that everybody can see what's being typed in. And if you have any technical issues throughout the session, what you can do is put send to host, and Elisa's on the line, and she can help you out and resolve any technical issues that you're having. So welcome. This is our fourth Share and Learn for PaCT, and it's been really a great experience and wonderful to hear from all of you. It's always great to hear or find out who's on the call. So if we can take a moment, I know many of you gather around at one computer with other colleagues in the same room. If you can add into the WebEx chat box your name as well as the names of other colleagues that are present today, that would be really helpful. Just give you a minute to do that, and great to see all the names start to pop up. We included a nice summer picture on there. I hope you guys, if you get the chance to get a bit of a break this summer, maybe jump into a lake. And it's cloudy right now, but hopefully those sunshiny days come back and you get a chance to enjoy that. That's great. The chat, perfect. All right. So the agenda, like I said, it's pretty packed. What we did find is the last Share and Learn was so great, we thought there was such great discussion. We thought, why not replicate it and use some of the same questions and hear from another clinic directly, and then get input from you guys, open it up for some of your stories again using the same questions. We will be using the Poll Everywhere tool, and we've got a Wordle again to start, similar to the last time for those that attended. And I'll talk more about the Poll Everywhere and some instructions in just a minute. For the stories from the field, we have teed up Life Medical Clinic from the McLeod River PCN to highlight some of the work that they're doing. And like I said, we will open it up to the rest of the group to contribute or ask questions. And I just want to say how valuable it is to hear from you guys. It fuels us at PaCT Central to hear some of the things that you guys are doing and learning and exploring. So just know how valuable that is. And I know that it also fuels some of the other clinics too by hearing what's being done and shared. So so valuable. So please keep those stories coming. So just run through quickly the questions so we can get you started thinking about what you might want to share. So what has been your biggest PaCT aha moment to date? What has been your greatest PaCT challenge or crash and burn? What has surprised you most about your PaCT work to date? And do you have PaCT innovations you would like to share? And we always like to highlight that it may be innovations from some of the work simulated from the test box, but it might also be some other things that you've come up with outside of the test box, which is always great to hear as we continue forward with PaCT and maybe start to add in new ideas. And Sue's going to be reading that discussion. And then we'll finish off with some quick updates around the PaCT measures, some upcoming dates and information around conferences, and just some things, some opportunities for you guys to explore. So we'll move on then to our Wordle. And hopefully, again, the technology gods are with us today. We're going to try out the poll everywhere again. And it really gives a chance for those that aren't familiar with it. You can respond by text or through a web browser, and it's anonymous. So it's just another feature in addition to like our chat box and coming off of mute that we've added, and we found it really worked well the last time, so we're going to try it again. So at the top of the screen, just below the question, you'll see some of the instructions. So I'll just walk you through the cell phone instructions to start. So those interested in responding by cell phone, just pull out your cell phone and go to create a new text message. And in the to section at the top of the text message, type in 37607. And then into the message box, type in, you'll see beside text, it says Michelle Henna 060. So type that into the message and press send. And what should happen is you will get a message back, so a text message back, stating that you've joined the session. And once that happens, then you can respond to our poll question. And so our poll question, same as last time, in one word, PaCT has been, and that might be, you know, what has PaCT meant to you so far in one word? So reflecting on either the full project or even the last 6 weeks. And then for those, while people are doing that through text, I'll just go through quickly. For those that want to respond by web browser, what you can do is you can see the address at the top of the screen there, pollev.com/Michelle Henna 060. You can put that into the top of like the URL on a web page, and what should pop up once you put that in, enter, is the web page with the poll question. So just check in, Lisa, are we getting some responses?
So we have one so far.
It hasn't yet confirmed the
Okay.
poll everywhere, just to let you know, Lisa, it's Carrie.
Okay. So just to check, so in a new text message, at the top, the number that you're almost like texting to is 37607. And then in the body, text the message Michelle Henna 060 to activate the poll everywhere.
I'm in the same boat as Carrie, Jennifer. It's not activated. I've used it many times, but I've been successful on the web.
Yeah, I have too. So I wanted to try it just to let people, you know, give you the sense, but it hasn't yet confirmed.
Okay, I'm going to give it a go too. Tried it yesterday.
It doesn't seem that the technology gods are with us today completely.
Darn it.
I am sharing my screen, so I just want to make sure everybody is seeing some results come up.
Yes, we are seeing it.
Okay, great.
Try. So for those that, I mean, it's working for some. For those that are responding, is it through text or is it through web browser that's actually working?
Web browser.
Interesting. Yeah, and you're right. For some reason, it's also not working as I am as well. Sorry, you cut out there.
It finally just came through on my text.
Okay.
There's actually an app that you can download as well. It's so easy. It's called Poll Everywhere. You can use. I think it's working for me.
Ah, that's a good tip for next time to set us up better with the technology gods. All right, a few more coming in. We even have Michelle's name on there again. Woohoo! All right, so invigorating, learning, productive, easy. I like that. That's good to hear that at least components are easy. Maybe we need to put some more challenging items in there. Interesting, overwhelming at times. And we feel the same way sometimes with PaCT Central. but an invigorating project really when it comes down to it. All right. Well, I'm glad. I'm not sure. Has anybody else started to receive at least some responses back from the text message saying that it's activated?
Just got it now, this second.
Okay. That's good to know. We might need to tee that up earlier in the intro for next time. Use it again.
Yeah, good point.
Awesome. So I think we will move on. Can you just actually show your screen one more time? You're going to take a snap. Okay, just you can leave it as is. Well, I was going to do the comparison. Sorry about that, Lisa. It's okay. Actually, just leave it.
All right. We can go back to it.
Yeah, I was just going to say, take a quick snapshot of the one that we have that's new, and we can just then shift back. So take a quick snapshot of that. We have enlightening added to it, and then lots in there. And this was our Wordle from last time, so we thought we'd just pull that up. Just for fun to compare, and some of the same type of language being used, which is good to see, that there's some consistency. It looks like, again, the technical issues might have impacted our response rate there, but hopefully that will get activated for you as we continue to use the Poll Everywhere. So I'm now going to pass the baton on to Sue, who's going to lead the stories from the field.
Thanks, Jennifer. So I'm very pleased to have a team here from McLeod River PCN Life Medical Clinic, and they will be leading us off on our discussion for each of the questions that we're posing. And we're looking forward to hearing from other teams as well. So please feel free to share as we go through the questions. So from Life Medical Clinic, the coaches at the clinic are Dr. Ojedikin and Lacey. And Kim, I'm going to get you to pronounce Lacey's last name because I never get it right.
I think she's on the line, but it's Berendret.
Okay, thank you.
I think I might have actually messed that up too because we would never say it.
Yeah.
I also have Mary.
Yeah, it's Berendret. Thank you, Lacey. So I'm glad you were able to make the call because I wasn't sure exactly who from the team would be here. So Lacey, I'll hand it off to you to introduce your team and also tell us about your improvement team for PaCT at Life Medical Clinic.
Sure, yeah. So we should have on the line, I'm calling in. So Kim is there with Mary, and she's our new MOA who is filling that MOA 2 position. So she's all trained up, and she's kind of getting that trial by fire into PaCT, and we're trying to transfer our knowledge as much as we can. She'll probably attest that we're probably not the best at it so far, but we're getting it. And I believe Dr. Joe is calling in as well. Is that right, Kim?
Yes, you.
Yeah, I'm here.
Okay. Hi, Dr. Joe.
Hey, how are you doing?
Yeah, good. So the four of us make up the improvement team in our clinic, and we also have another MOA, Jessica, who attends fairly frequently now, just as we're trying to reroute a whole bunch of our roles and cross-train and just reformatting how we do things at the clinic. We're finding that added benefit to incorporate a few more team members.
Perfect. Thanks, Lacey. So just moving to our first question. The question is what has been your biggest PaCT aha moment to date?
Okay, so I will speak from here. Lacey, and she can intervene too. I'm Kim. So our biggest moment was realizing that the things that we thought were important to the patient actually didn't make it on the top 10 list. So, and we received all that feedback back from, of course, there you see a picture of our patient representative, Al, and he had a big impact on our development of our PaCT process. So that was our biggest moment, is that what we thought was important didn't actually make it on the patient's list. Was in the top
interesting.
10. It was very down at the bottom, and then it kept, of course, it transitions and changes, but in the moment that we visited them the first time, we were wrong.
Yeah.
So I love this quote, and this quote came from Al, who attended our PaCT kickoff in Edmonton and was at the table. And as we were having discussions, it was at that point that he said, oh, I just realized the first time that this document is for me. And the whole time when he had been involved with the PaCT QI team, right from the very, very beginning and starting to have those discussions, he had the impression this was something that was for the physicians and not necessarily for the patients. So it was just this huge light bulb went on in the middle of our PaCT coaches session. So it was really great. Now I also understand that that you may be looking at adding other patient team members to your QI team. Can you tell us a little bit more about that?
Yes, we are. Lacey, you want to talk on that? Who?
I can talk a little into that.
Oh, so, Dr. Jones, yeah?
Yeah, let me talk a little into that. So I think what, again, just to expatiate a little what Kim was trying to explain there about what we thought was important. Patients' agenda are always different from doctor's agenda. And it was a good exercise for us. It was a good experience for us to actually see what matters to patients. Patients are not used to being asking that, and doctors are not used to asking patients that. And it was an eye-opener for us to see what could actually come out when we begin to ask that question and when patients begin to process that question. So I think that was a big thing for us. And of course, having the patient perspective on the PaCT team was very productive for us. In terms of, it was a humbling experience for us to tap into a patient's perspective in the planning of the whole thing. And I think that's something that's emerging in healthcare, involving the end users in the planning stage of any project. And I think that was a very good thing that was brought into PaCT from the early stage. And so in terms of our being part of it has COPDs and oxygen, and we recognize that he's becoming weaker, and he may not be able to make all our meetings. We still very much welcome his input, and he's still very interested in attending, but as his doctor, I think I'm beginning to think we should begin to excuse him from some of the meetings. And so we have the option and we have the opportunity to invite one or two other patients, and we're working on that. I think Lacey has been in contact with one of them. And it's actually one of the patients we have met, and she's very, she was very, she's, how am I going to put it? We thought she liked the whole process. Her feedback was very good, and we think she's going to be a very good team member. So I don't think we've heard back from her, but our plan is to have maybe at least two patient representatives, so that the burden is not too much on one person, because we meet every week.
Yes, that's a very good point. Yes. And I just wanted to open it up to the others on the call, just around their experiences with patient representatives on the team. Now, you could chat in, you can unmute and feel free to speak up, or we have also opened the polling everywhere you could just type in your messages, and we have Cindy as well as Jennifer reviewing those. So would anyone like to comment about patient representatives on the QI team? It seems like
we do have some patient representatives on the line too, so it'd also be interesting to hear your perspective of how your experience has been.
Being a little shy today, that's okay. Would someone like to comment on patient representative, or to share what's been your biggest PaCT aha moment to date? I'll invite those as well.
Riverside Medical here. Our patient representative is here. Go ahead, Brenda.
This has been a wonderful experience for me to come to this clinic and to be part of the overall clinic experience.
Brenda, we're having a little trouble hearing you, so if you could speak up just a little bit more. Thank you.
I've been in the healthcare profession as an LPN at one time, and then as a patient through many different health issues. And coming to Dr. Brand's clinic was a wonderful experience. It was great, and it's been wonderful. And then to be asked to be a patient representative was even better.
That's fantastic. And anyone from the team like to comment about that experience of having a patient there? How has it changed your work?
I would say it hasn't changed our work or our focus in a specific manner, because we always want to be patient-centric and have patients as the focus. So in a way, it was a very easy transition for us to have patients directly involved in the underlying inner workings of how our team-based care in the clinic goes from day to day and week to week.
Thank you for that. So it was a pretty easy transition for you then. And I think some teams are a little frightened about having patients there in their meetings while they're discussing it. But what we've heard from two teams is that it has been a very easy experience kind of transitioning them in to the QI team. So that's great. So I think we'll move on to our next question. So back to the McLeod River PCN team, Life Medical. So what has been your greatest PaCT challenge or crash and burn?
So our biggest challenge was coordinating resources and defining who was absolutely essential in our PaCT process. And also transferring that knowledge to all of the resources involved and including those in charge to allocate those resources. So mental health was one of our big resources that needs to be a part of our team. And it's hard to resource that outside of the clinic and get them in our clinic and just on a continuous basis or not on any time of the day at any time of the week during our clinic hours.
Right, so coordinating with those team members, like accessing services that are outside of the patient's medical home, and just the challenges with coordinating that, first of all, accessing it, and then also coordinating the time. Lacey, did you want to talk about your panel confirmation rate?
Yeah, sure. So I know that we have talked about documenting our verification rate, and we are utilizing the verification run chart that's on the Towards Optimized Practice website. And we were looking to when our first documented verification rate was, and it was 45% when we started the PaCT process. And, this was something that wasn't new to us. We had been talking about this within the clinic. We had established processes. We talked to the front staff and the booking staff. At that time, there was 5 different people taking calls, booking patients, and that were involved in that verification process. So it was something that we had thought we were doing a pretty good job of, or that we had enough awareness in that area that that process was being followed for our verification rates. And when I pulled that initial data, I was like, wow, that's pretty terrible. Yeah. So we would have occasional, spikes where everybody, when we would meet in the morning and everybody was kind of on board, and they would really be focusing on verification. And then, as the week kind of goes on and the next week and it's not in the forefront of the mind, we would see those dips again in the data. So I would say that was the biggest one within our clinic, that just because we were measuring it so frequently that we really seen it was something we thought we were doing a much better job of initially, and we just weren't.
Yes, so thank you for highlighting the importance of measurement, and often we measure when we're implementing something new, but then we stop measuring, and you just highlighted the importance of continuing to monitor, because of course if you're having staffing changes, those processes may not stay at the rate that you're looking for, and so I think it's interesting too that you're looking at measuring it on a daily basis, and so and that was your decision to look at it on a daily basis. Sometimes teams are measuring it every 3 months. Sometimes teams are measuring it monthly, and usually when we're trying to make a change, it's at least weekly that we're measuring it. So, but thank you so much. And we do have one question from Stephanie Balco. How exactly do you measure panel confirmation rate, numerator and denominator? Lacey, do you want to walk Stephanie through that?
Sure. So we're using the Wolf EMR, and in our practice search, we're able to see when the last visit was, and exactly like when we're trying to make change, we like that short measurement interval. And with our team, we thought a week was just too long, so that's why we're measuring the day. And there's 2 ways you could do it. You go into the practice search and you go to last visit, and you can say in the last day, but I don't find that pulls clean enough data from Wolf. So I do it between, you would select the between which days, and I just pick whatever day. So for example, it would be 31/05/2018. And then 31/05/2018, so it picks a very specific 24-hour period, and that's the one that I use as my as my denominator, and then keeping that search up, I then click on my data verified or last verification, and then I do the same thing between that same date. So if you, that's how we do it with Wolf, and I'm not sure what other EMR they're using, but we do have a specific field that we can search. It's a specific box that you click when you verify them, and I think most EMRs are equipped with this search.
Yeah, thank you. Thank you, Lacey, for sure. And so I'd like to direct, if people have questions about their particular EMR, that is addressed in the top tip sheets, the EMR guides that we have on the website. As well, the how to do this is also in the STEP documents, the supportive tools for every panel documents that are also on the website that were developed by the Equip team in the Calgary area. And it's also have some very helpful information about the how-tos on panel confirmation rate. So now I would just like to invite anyone to chime in anything further about your challenge or crash and burn or anything else you'd like to add here.
Would I quickly just ask that, I mean, maybe Lisa, you can speak into that, that while doing the panel confirmation rate measurements and all that, we had to kind of review our system as well in terms of the people confirming the panel, confirming the panel and things like that. Because we used to have all the staff do panel confirmation and things like that, but we had to streamline it to just one person making phone calls and one person just at the front checking people in, so that we can actually, so that it can be easy for us to trace how people are working, to trace where the problems might be, because before that it was difficult for us to know who was doing, who was confirming, who wasn't confirming, and there was no way Wolf could give us information about individual confirmation rates. Am I right, Lucy?
Yeah, so interesting that that you're really looking at your roles, and we'll be getting into this more in test box 3, and in terms of you know, documenting those roles and responsibility, who's doing what, having that shared understanding amongst the team as to what the responsibilities are. And again, I just want to put another plug into for the STEP documents, because that workbook that is associated with the STEP toolkit will take you through many of those exercises in terms of exactly what you're talking about, Dr. Ajetikin, is really focusing on those roles and responsibilities. And often teams have a binder where all of that information is kept in with their STEP toolkit, and all of the documents then, and that they're readily available and then can be updated. So thank you. Well, I think we'll move on to our next question. Of course, if you have a crash and burn that you would like to share, just feel free to pipe up at any time. The next question for the Life Medical team is, what has surprised you most about your PaCT work to date?
Okay, so when we targeted the group that we wanted to work with, we were actually surprised with who is utilizing the ER the most. It was very different from our original suspicion, and also how much of an impact one collaborative meeting for a patient can make. It can bring them from the brink of being overwhelmed to having a team in place that has a plan with them. And we knew it would impact them, but the feedback was just so positive. Also, our biggest impact was, as you see, our verification rate. We were very overwhelmed by our starting measure, and despite all of our meetings and everything else. So we made drastic changes there. Another thing was in working through the PaCT test boxes, that's what initiated us. Those boxes and those measurements really helped us make our staff duties and our role changes within our clinic and identify our own deficiencies. And yeah, that process really helped us evolve and take our clinic in a new direction.
Wow, so your team has encountered lots of surprises along the way. So I just wanted to unpack a couple of things that you had talked about. So my understanding of your team is that when you started, you had a particular population that you thought you were going to start with. And correct me if I'm wrong, but that was going to be focused on those patients with diabetes, hypertension, COPD. Is that correct?
Yeah.
Yes.
Yes, and so then you went through a data analysis exercise, which is extremely well documented in a white paper that Life Medical Clinic has shared with us, and you can find these resources on the PaCT website under resources from field teams. And so this white paper is on there, and what was done was really looking at who from your clinic is actually utilizing the emergency rooms and the hospitals, and who are your highest utilizers of those resources. And so how has your target population changed? So who are you focusing on now with PaCT?
I'll let Dr. Joseph speak.
So, yeah, it looks as if we kind of created problems for ourselves. Initially, like Lisa would say, we kind of focused the low-hanging fruits, diabetes, COPD, people that were listed on the previous 0304J list of chronic medical conditions. And but at a point we decided to ask ourselves, who is PaCT really for? Who are those people that have rising health needs? Who are the people that, they are not very sick yet, but they are already giving us indication that if we don't meet their health needs, they'll be ending up a lot of times in the hospital, admitted. There'll be a lot of spending on their health and things like that. So we went through the data analysis you talked about, quite extensive. We looked at almost over 10,000 number of patients, the people utilizing our emergency department most often, and we categorized them into those with COPD, anxiety, all kind of mental health problems, diabetes, and all the chronic medical problems that we know. And we found that most of them have, if not, in fact, probably more than 80% of them have a mental health problem, particularly anxiety. So anxiety, depression, almost all of them have mental health problems. And that really opened our eyes to see how deficient the service in our community is for this group of people. So we decided that if we really want to impact in people's lives, we really want to have a team-based care for anybody, it has to be people that have mental health problems in addition to other chronic medical problems. So we identified COPD as part of it, diabetes and all those, but they must have mental health as part of their problems. And we were able to categorize those people into middle-aged people and young people. So that's what that's the result of the document you're talking about. And that, again, opened up some challenges for us because that meant reallocating resources in our community. We had to meet with PCN, we had to meet with some other doctors, we had to meet with the mental health group in our community to see how they can support us we felt the only way forward for us is to have a mental health person on our team. We felt there would be no PaCT in our PCN without a mental health support or contribution on our team, and getting that was quite challenging. Actually, our PaCT was shut down for several weeks because we had a challenge, but we stood our ground that that's what we need if we have to do PaCT. Without that, we can't go ahead, and eventually, and things are working fine now. We are back running. We have the support of the PCN. We have the support from our local mental health services. We have someone that comes from mental health every week to join our meeting, and I think that's a very positive thing. Again, it opened our eyes to see how if you want to get something really, something well done, you have to fight for it, because it can be challenging trying to overcome old paradigms, and I think that's something we're proud of.
Yes, for sure. And interesting that your target population completely changed. I want to share something that in a conversation that I had with you, Dr. Ojedikan, that struck me so much about the patients that you have seen for the care planning process, and their realization that they now have a team who supports them. And Dr. Ojedikan was mentioning to me that these patients are now calling the clinic asking to speak to someone on their team. Which is very cool, that they realize that they have a team of people that are there to support them. And I just loved hearing that story, so thank you.
I just wanted to add to that what Dr. Joe was mentioning about how we were so surprised about what our target population was going to be. And I mean, mental health didn't just come, ahead of COPD or asthma by a little bit. It was, 4 or 5 times, in some cases 10 times occurring more often in the emergency department than what we thought was there. And then building on, giving support in our clinic and the things that are worth investing in and fighting for, it was really surprising how, to us as, a PaCT team, how little our PCN kind of knew about the process and what was needed and included, and what kind of support we were going to need in taking on this endeavor. That was really surprising for us.
And the other thing I just wanted to mention too is that when you look at your AIM statement, you're focusing on those patients. The ones who are showing up a lot in the emergency department are also the people that you see fairly often in the clinic as well. And so I think that's really interesting because, we thought that maybe the patients that we need to be seeing are those that maybe have not been in the clinic for quite some time, but you're realizing that these patients do come in often, but maybe that they're needing something different.
Yeah. Absolutely, and it could be just because of the population in our AIM population that, as when mental health starts, being unmanageable at home, we are seeing that over access or increased access, and that's kind of how it manifests before it's maybe difficult to even manage in the community setting. So it might be different for other target populations, but that's just where the data brought us to.
Very interesting. Would anyone else like to comment or tell us and share what has surprised you most about your PaCT work to date? No one wanting to share right now? That's okay. We will move on.
Sue, it's Carrie. I have nothing to share, but I just wanted to chime in about how valuable I feel this discussion is. I want to thank this team for coming forward on using data for decision making, because it can surprise you if you kind of go with your gut, you're not quite sure, but the data, I'm so impressed by this, and I'm grateful that you're sharing it to the entire group and for being brave, because I feel like I can carry your story forward to other teams. So thank you so very much.
Yeah, Carrie, to add to that, it's not just for their internal decision making, but it really struck me too how they took it out to influence outside of their clinic as well. And I think that's really powerful and something we need to drive more as a system. So yeah, thanks for both of those.
And yes, thank you both, Carrie and Lori. And you had supports when you were doing this data analysis. So you had an agreement with Alberta Health Services that helped pull this data for you. And then you also had the support of your evaluator within your PCN also to help sift through some of the data. So I would encourage teams, if they're interested in doing this kind of analysis, to look at the top website and have a look at the white paper. It's an excellent resource. All right, so I think we're going to move on, just in the interest of time, to our next question is, do you have any PaCT innovations that you would like to share?
Okay, so when the patient comes after their visit, we spent some time to put together a patient survey, but this is what the patient survey looks like on the care planning visit. The patient will leave with that survey and a prepaid postage envelope. So we give them 2 weeks because, of course, that's probably been a very overwhelming visit and they have a lot to sort of process. And then we have the MOA follow up with them just to check in with them, see how they're doing, and provide them a little reminder that, you know, if we haven't got their survey back, just to have their survey completed and to mail it back to us. One of our next things that we did is when you go in a room, the doctor, the nurse, your mental health care professional, each have to document things, but nothing is worse than somebody having a computer, and we did hear that back from our patients that were on our panels, that, you know, just looking away from them. So we did create a PaCT note-taking, which can just briefly let them jot a few things down, but then glance back up and make constant eye contact with the patient. The actual template of this care plan template, it was just too large, and I think it was at 3 or 4 pages. We've shortened it down to 2 and simplified it, that this is all the patient needs to carry around. So we just thought it was just too much, and that didn't need to be on there. Also, our own communication amongst our team in our clinic, we now use Slack on our cell phones and on our computers, because if you're not in your EMR, and the MOA that's working as the physician's assistant is running around the clinic, the doctor can utilize Slack, and a message will pop up. And we also can send documents on Slack and just anything that's in the moment. So we're all utilizing Slack. We're also attempting to integrate a patient rep and pharmacy to contribute. Like I said, we're trying to find a new rep, but we want to have our pharmacy involved to contribute and review this template, just to get their feedback on if there should be any modifications or additions with prescriptions. And there was an initial, like I said, PaCT representative to our clinic, physicians that are aware that this initiative is taking place within our clinic, and so we presented it to our physicians, and just to transfer that knowledge to our whole medical staff. So they're not doing it yet, but we're involving them and integrating them now to make them a part of it.
Right, and hoping for from some spread as you continue on. I know you're spending a lot of time working on those test box items, but it's great that you're communicating with others on your team so that they have an awareness, and when you're ready, then being able to have more physicians and more team members join the initiative. We have a question from Mia. Can you explain what Slack is?
Well, it's an app that you can put on your phone, and it's just like Messenger, or it's a messaging system. But like Dr. Joseph, he's a big fan of Slack, so he's the one that we. Go ahead, Dr. Joseph.
Yeah, so Slack is, it's an app. So you can download it on any mobile device, and so teams can work on it. So every team member is represented on the application, and you can use to send information to everybody to see instead of using emails as an instant message, and the people can respond quickly. You can send messages individually or to the group. You can write a meeting there. People can contribute to agenda before the meeting comes. The last agenda, people have access to it. You can delegate work or responsibilities to people before the next meeting and things like that. I think it's a good way to communicate sometimes, even to jot down your own ideas before the next meeting, and people can see what you're thinking. So I think it's an innovative tool for everybody to use as a team.
And I understand that you have tested a number of different tools before arriving at Slack, correct? I know you did a number of PDSA cycles on different tools.
Yeah. So Lacey and I were just picking up. We used Hangouts. We used there was another one. I think there was a time we tried to use WhatsApp, and eventually we came down with Slack. We kind of decided on what we thought would be useful, something we can attach documents to easily, and something everybody would have easy access to, and something that can work as an instant messenger as well. So I think it fits that. And in addition to that, something that people can get an alert on their wristwatch for people using iWatch and things like that. So it has worked for us at all those levels, and so far we're happy with it.
Great, thank you. Are there any questions or anything that anyone would like to add around PaCT innovations they'd like to share?
Just a quick something I want to say about the template thing that Kim was talking about. Thanks very much, Kim. That's the next one actually we're working on now. We are hoping to condense the current templates such that we can invite our local pharmacies to contribute to it. We're working on that. Currently, the way things work is that we do our own care planning through the previous O304J. The pharmacies do their own, and there are so many documents in the EMR about just one patient, and everybody's not on the same page. Similar to what Dr. Sarah did in Edson. So we're hoping to condense this care template to maybe just 2 pages, and send it to the pharmacy to contribute to it. And it can go along with the patient's green sleeves that everybody carry around, such that it will be an easy read, easy use in emergency situations, in the hospital. Patients carry it everywhere. And the pharmacists and the doctors can use the same care planning, and it will be updated every year. So you have just one sheet every year, and a new year, just open the second one. So we're still working on that, and I'm quite excited about that. Perfect.
Thank you. And again, the documents, the survey, as well as the current care plan that Life Medical is working on right now is available on our website as well under shared resources. So I think I'm now going to hand it over to Bonnie just to give us an update on PaCT measures. But thank you so much, Life Medical team, for presenting today. It was fantastic.
Thank you, Sue, and thank you, Life Medical. This is Bonnie LaCusta. I think I've met most of you virtually, but if I haven't met you, I'm leading the evaluation work for PaCT, and I just wanted to spend a minute or two to give you some updates. I think for the coaches on the call, you've probably received an email saying that we're looking for another round of data collection, and some of you have sent that in, so thanks very much. For those who may still be working on their PaCT measures, and if you're running into roadblocks or road bumps, please feel free to reach out to me or any member of the evaluation working group at any time. I would love to help you out. I just wanted to give an update because you're probably wondering what was going on. I think I promised you all some updates and you haven't seen those yet. So for those who participated in our feedback sessions a few months ago, your feedback has really been fantastic. It was exactly what we were looking for. We've reviewed it, we've compiled it, we've summarized it and made a series of recommendations, and we're just at the stage now of acting on those recommendations and actually making some changes. So we are hoping to make things a little bit easier for measurement, make sure that it's value add and continuing to offer value to you as the clinic teams. We are looking to add things like the panel confirmation rate run chart that you just saw Lacey show us the value in, so that'll hopefully be available for the rest of the teams. I just wanted to acknowledge I had hoped to get the measures updated by this round of data collection. Unfortunately, that hasn't happened, but I will commit to you to have them out to you well in advance of the next round of PaCT measurement so that you'll have an opportunity to look at the changes, look at the updated instruction guide with added clarity, and you can let me know if there's any further questions. But because this really is the innovation hub phase of PaCT, there is no wrong time to be submitting feedback to us. So if you do have aha moments about the measures, additional questions, or more feedback for me, you can reach out to me at any time. My email and phone number are there. And, yep, I tried to do that really quickly. So if you have any questions,
Thank you.
Thanks, Bonnie. Yeah, so we'll finish off with what's next. And just to show you, we're trying something new this time. We did post early in advance of the coaches session the test box 3 material. I know that some of you guys have been chomping at the bit to look at maybe what we're delivering for test box 3. So it is now posted. And important dates coming up. So the next, we did decide that we would move the coaches prep to accommodate having Michelle back and attending, and that based on your feedback, we landed on Monday, June 11th. That's at 8 a.m. So if you need to put a little reminder in your calendar Friday or Sunday night that you have a first thing in the morning coaches prep meeting, please do so. I know I might have to. And then the other dates are there, which are also on our website. Next, just wanted to make you guys aware of the Accelerating Primary Care Conference. The topic is very relevant to PaCT work. We'd love to see some of you guys share, either through a verbal or poster presentation, the work that you're doing. So please consider that. And if you need any help, don't hesitate to ask our PaCT Central or IA team. And I'll just pass it off quickly to Cindy.
Thanks, Jennifer. I think in the interest of time and getting everybody out on time, maybe we'll leave this one to next time. This is just about awarding some pink socks to a person or a team that inspired you today and moving forward the social movement of the Pink Socks Life. So if you're interested in more information, check out Pink Socks Life and we can revisit this next time because I know there's at least one other slide for last minute questions.
So we'll see if our technology gods are back with us right now. And any questions, comments, or musings, if you'd like to text them in to Michelle Hannah 060, and we'd be happy to collect them, and that will help us inform coaches training as well as the next Share and Learn. So please feel free to share.
Thanks, everybody, for joining today.
Yes, thank you so much. And thank you again, Life Medical team. So appreciate the information. Thank you. Have a great day, everyone.
Thanks, bye.
Bye-bye.